Hello and welcome to today's issue briefing hosted by Act for Public Health. My name is Joelle Lester. I'm the Executive Director at the Public Health Law Center, a national nonprofit legal center based in St. Paul, Minnesota, working to improve health through the power of law and policy. And I'm here with Sabrina Adler. Sabrina, do you want to introduce yourself?
Sure. Thanks, Joelle. I'm Sabrina Adler. I'm the Vice President of Law at ChangeLab Solutions. We also work nationally to use the tools of law and policy to advance health equity. It's great to be here.
So thank you all for joining us. We are really happy with the intense interest in these topics and happy to play a part in answering some questions and clarifying some confusion. So just briefly, this is part of a series hosted by Act for Public Health. Act for Public Health is a collaboration of legal centers, including ChangeLab Solutions and the Public Health Law Center, and we're joined by the Center for Public Health Law Research, Public Health Law Watch, and the Network for Public Health Law in that work. So today we are kicking off a briefing series, and we're going to spend our time today giving you a little bit of an overview of what public health is facing in this moment, as well as what we're going to cover in this briefing series going forward. We're also going to talk a little bit about strategy, how to think about and approach this particular moment, and some resources that are available both from ChangeLab and the Public Health Law Center, and also many other wonderful organizations working in public health law, and the law to try to resist attacks on public health infrastructure and civil society. And we had a webinar covering some of the executive orders and related litigation that have come out in the current administration about a month ago. And more than 2,000 people registered for that webinar. The interest was overwhelming. We had over 1,000 people attend it live. And so it was just really clear that there is a need for this information about how your own work and organization could be impacted, and how to move forward in this current moment. In addition to so many people attending, we had hundreds of questions, which we have been combing through and trying to use to develop additional resources, publications, this briefing series, for example, to try to give a platform for us to share the information we have, what we know, and also to continue to hear from you about what additional information and resources might be needed. So I'm going to turn it over to Sabrina to talk a little bit about the current state of things.
Yeah, thank you, Joelle. And thanks to everyone for joining us. There's a lot going on right now, as I'm sure everyone is aware. And as lawyers, I think it's important to point out that not everything that's happening is legal. The executive branch and the federal government as a whole, they don't have unlimited authority. And that's why we see courts stepping in, et cetera. And, we have a system of checks and balances that is working in different ways right now. But before we dive a little bit into strategy and sort of how we're thinking about this moment and what folks can be doing, I just want to do a little bit of a recap of some of the information that we shared about executive orders in the previous webinar. So some folks may have joined that webinar, and we also have some written resources on this, but I think it's helpful to drive home some of these points as well, and to just, they bear repeating. So from a definitional perspective, federal executive orders are written directives that come from the President of the United States, and they shape federal policy in several different specific ways. So their typical use is to manage the agencies and employees that are under the president's control. So, for example, in the public health space and health related space, we think a lot about the Department of Health and Human Services and all the related agencies, or the Food and Drug Administration. And those orders may require folks in that federal executive branch to take or refrain from taking specific actions. But I think the point that we really tried to make in our previous webinar, and that we will make again here, is that executive orders cannot change statutes or the Constitution or judicial interpretations of laws. They don't act in the same way as some of those far-reaching laws. And generally, though I'm going to get to some ways in which this is, there are ways that they do this. Generally, they don't govern the conduct of actors outside of the executive branch. They are like limited in their scope in that way. However, they can affect actors outside the executive branch, and that's for a couple of different reasons. First, federal agencies interact with, for example, local and state government actors all the time. They also do things like provide funding. As you well know, they promulgate rules and regulations that apply more broadly, and they take many actions that otherwise affect what is happening both at other levels of the government, but also outside the government for actors outside the government. So because of that, a number of the executive orders and other federal actions, so the executive orders are one piece of it, but there are other federal actions too that have been taken in accordance with these EOs are really having a profound impact on the practice of public health. And I'm guessing that's why folks are here today. So this won't be news to you. The rest of the briefing series that we are kicking off today it will dive into some more specifics on various topics. So we're not going to go deep on any one topic today. We are just sort of setting the stage in terms of background and some thoughts about strategy. And then one other thing I want to point out too, and then Joelle, I would love for you to fill in too, if there are points about sort of what we're seeing happening that you would like to add to, but as I'm sure folks are following, there's also a lot of litigation happening right now. A lot of the federal actions, the orders themselves, but also things, again, that have happened sort of in response, that actions that the federal government has taken in response to those orders have been challenged in court. And a lot of those cases are still making their way through court. I think we will drop some trackers into the chat and some other resources that you can use to follow, and for sure invite questions to you to reach out to us if you have questions that we can answer specifically about some of the litigation. But there are themes that are coming up there. We're seeing a lot of litigation around the separation of powers. So that constitutional principle that the different branches of government sort of have different purviews, and that the executive, for example, here cannot overstep the sort of powers that are granted to it. There are issues around free speech and what you can and can't require folks to say, language that you can and can't use. There are issues around unconstitutional conditions. So when you're providing funding, for example, like, can you force folks to act or not act in a certain way based on the provision of that funding? Equal protection is something that's coming up, and civil rights protections more broadly. Things like due process, we're seeing that has come up a lot in the immigration space, but in other spaces as well. So those are just some of the themes, I think, in the legal issues that are coming up. But let me pause. I've just thrown a lot of information on the table and ask Joelle if you want to add anything to that or.
Yeah, I would just underscore, I think that if you are like me, you might be saying to yourself when you read headlines in the morning, that can't be legal. And you're probably right. So I think Sabrina's recitation of all of those legal issues that are being sorted out in the courts, those are very good arguments against some of the actions taken by the administration, both executive orders and other actions that they have taken. And then I just wanted to also address the non-executive order activity that has probably had very real impacts in some of your day-to-day lives and in our work. The mass layoffs of HHS staff, including the entire CDC Office on Smoking and Health and other whole functions at the CDC that have been longtime critical resources and advocates for community health around the country. Those just happened by action by the secretary, and sort of using the funding mechanisms to try to control speech is also something that's happening sort of outside of executive orders, but it's having very real impacts on state and local grantees, state and local health departments, and those of us who are nonprofits working in the public health law and policy space. And I know we have seen sort of direct consequences already and lost some really wonderful colleagues who have been longtime public servants. So just want to acknowledge that. And I guess I'll take that moment to also just acknowledge this is a really hard time for all of us. And if you are feeling overwhelmed, you are not alone. And so I think that the way through this is together. And I am so appreciative of the partnership we have with ChangeLab and the other partners that Act for Public Health. There are incredible legal organizations like Democracy Forward, the NAACP Legal Defense Fund, and others who are leading the way on the litigation challenges, and the ACLU, which is providing incredibly important resources. So I just want to acknowledge that we exist in this larger ecosystem of people using their own resources and expertise to try to protect public health gains, public health authority, and infrastructure at this time.
Yeah, thank you, Joelle, for acknowledging that. I think it's really important to say out loud. So I think related to that, like, let's switch to strategy a little bit. I think, we get a lot of questions, and in the webinar that we did initially got a lot of questions about, okay, so what can we do? And so maybe I'll kick us off with just two high level points, and then we can dive a little bit more into some specifics. But first, I just, in the vein of acknowledging, I want to say, Joelle pointed out, and I also said that a lot of what's happening is not legal. I think that is both an objective fact, and there are things that are around the edges, unclear if they are legal. And just because something is not legal does not reduce the challenge that I think a lot of folks are facing in figuring out how to react in the moment. You may know that it's illegal for the federal government to do X thing, and you may be faced with the threat of losing your funding, at least in the short term, because you're not complying, even if the litigation that has ensued plays out and ultimately that order gets struck down. So really that day-to-day challenge, I think, is a lot of what we are hearing about and getting questions about. And so I think I wanted to just share a high-level framework that I cannot take credit for this. This came from our colleagues and friends at the ACLU to really think about how to approach this time, which might be helpful. And then we can dive into some specifics of what this might look like. But it's really a three-part framework. The first piece is standing together. So knowing that you're not alone in trying to navigate this time. I think that in offering this space and others, I think that's one thing that we are trying to do, but all of you also, there are many folks that are in the same boat. So that's one piece. The second is prepare. So think through how you might respond to various scenarios, understand what's going on, seeking out information through venues like this, but there are many others as well, seeking out reliable sources of information, etc. And then this third piece is winning the narrative battle in the court of public opinion. So part of this, and we're going to get into this more, is around storytelling and really sharing what's going on. So again, it's the standing together, preparing, and winning the narrative battle in the court of public opinion. With that, Joelle, do you want to dive into a little more detail on any of those points?
Yeah. So the stand together piece I want to emphasize is it's going to be critical for our survival through this really difficult time. And it's extra important from an equity perspective because the harms of these actions are sweeping, but they are more deeply felt by some members of the public health community, some organizations. So for example, of the research grants that were cut, they are disproportionately led by female principal investigators, despite female principal investigators being a minority of NIH grants. When we saw terminations around the DEI executive order at federal agencies, those were disproportionately Black, Indigenous, and folks of color, including using race, it seemed like, as a proxy sometimes for someone doing DEI work. And so I think that, I just want to lift that part up of what is happening, that it's terribly harmful for everyone, and it's worse for people who have historically been treated least fairly and have least power and access to systems. But I think that how you stand together can look a lot of different ways. So, I think that you have to take stock of what your organization has an appetite for, and do some risk assessment and decide what role you want to play. And the solidarity required also means we respect each other's decisions about how public and bold to be in speaking out and taking a stand. So some organizations are going to file lawsuits against the administration, and that's amazing. APHA led one of the very first lawsuits challenging an executive order, and not everyone is going to feel able to do that. And that has to be okay for all of us. We have to each do what we can, and then support, try to deliver the benefits of these fights that we're fighting to our fellow organizations and public health advocates and leaders. So that's the solidarity one.
No, thank you. I think a couple of things I will just add to that, picking up on the litigation theme. Yes, the litigation is critically important. And as Joelle said, that's not a path that everyone can take. I think I just want to lift up a couple of ways that folks might be able to get involved, in addition to just tracking what's going on, which I think is very important. But in litigation efforts, even if they are not able to be a plaintiff or the one that is filing the lawsuit or sort of a named party to the lawsuit. So in many of these lawsuits, there are amicus briefs being filed, friend of the court briefs, where other folks sort of lend their support to the lawsuit and to the arguments that are being made without having to actually be a party to the lawsuit. So that is certainly something that folks who are able to participate a little bit more publicly, but not participate actively as a litigant, might be interested in joining. And if you have questions about sort of what it means to participate in amicus briefs or want to be connected with folks that are litigating, that's a role that I think Act for Public Health, please feel free to reach out to us and we can try and make some of those connections. Similarly, I know one thing that's come up a lot is some of this litigation is broader than just the public health sphere, right? Some of these executive orders, many of them have a much broader impact and are affecting folks across different sectors. And the folks that are litigating, it's really helpful for them to understand what the effect is in the public health world specifically. So if there are things like you see that there's a lawsuit challenging something and it has really impacted your work and you feel like having that story, and I think we'll talk a little more about story. I'm going to pass it back to you, Preview, Joelle, talk a little bit more storytelling more generally, but in the litigation context, to really lift up for the judges who are the ones making these decisions, like what is the real world impact of these cuts, of these changes, of these threats. And so sharing some of that, I think, is extremely helpful to the folks that are litigating. They only have eyes and ears in so many places at once. So that's another thing that we can help with here at Act for Public Health, which is making those connections. So I would just put those two sort of invitations related to litigation and standing together on the table. But coming back to the storytelling piece, Joelle, do you want to dig a little bit more into that? Because I think that's a really important broader idea as well.
Absolutely. So, what gets lost in the flurry of headlines about these actions is how it's going to play out in the day-to-day lives of members of your community. And we need to be telling those stories, capturing them, and amplifying them at every level, really. So, I have been spending a lot of time talking to people in my personal life just about what the things that they're reading about in the news mean for my organization, for my work, for partners who I've worked with. And we need to be doing the same thing, every one of us, in our own circles and small communities, and then also sharing those stories. So, with your local boards of health association, with your public health association in your state. The American Public Health Association is collecting stories. They're a great place to go and share your information. The stories are so important to help folks, to make it resonant for folks, and to take what seems like a big bureaucratic or legal thing that's really at a distance, to bring it home and making it real for how this is going to affect emergency response in your community, safe water in your community, safe schools. in your community. And so I think that practicing telling your own story, making this something you do internally with your organization or within your advocacy coalitions will be really useful. And then making sure that you are sharing those as widely as you can. It's also important, APHA, by collecting those stories, can help weave together a broader narrative about the specific impacts of these actions. And they can help members of the media who are interested in understanding and sharing what is happening and the impacts at the community level. They can connect them with those of you who are interested in speaking to the media, which again, it won't be everyone. But, I think that we aren't, although we're public health people and we want to win by data and statistics, a powerful story is really what we need to help shape public opinion. And there is no way out of this without shifting public opinion to better understanding the importance of full investment in public health infrastructure at every level to deliver public health services and protections to communities.
Just to add like a fine point to some of that, because yes, 100% to that. And I will credit Sarah Dickey, our CEO, for sharing this observation in some conversations that she's been having, that particularly for policymakers, a lot of them don't actually understand what public health does. Some of them have a great grasp, but others don't. And so really knowing what's at stake here, and alongside the conversations that are happening right now about Medicaid cuts, particularly, and other threats to insurance coverage, like the role that the public health system plays as a backup supplement partner to healthcare as a sector, which I think people have a better grasp of, like what that means, the healthcare sector as opposed to public health. And you'd think coming out of COVID, this would be a little bit more obvious, but it's so much broader than just vaccines and masks, right? And I think that's like the takeaway that many people had. And so in the conversations about Medicaid, really like adding that public health angle as well, I think is important. And then the other thing, just like on a different thread, but related to this, just about advocacy and lobbying. I know a lot of folks in their official capacities, it's hard. Telling stories is not lobbying, just like factually not lobbying. It's sharing information. You're not, when you couple it with an ask for a certain policy outcome, then it becomes lobbying in some circumstances. But I know that also can be a scary topic, especially when folks are faced with a threat of loss of funding, et cetera. So we do have some resources on advocacy versus lobbying. There's some other great partners that we work with too, who are really great about educating around advocacy, but there's so much advocacy work that can be done that does not cross that line into lobbying. And so now is a great time to get a handle on what those lines are and really think through in your organization or your agency and in your personal capacity, what you might be able to do.
Can I just add, based on one of the comments in the chat, and we appreciate any questions you have. We won't be able to answer them live, but we will try to incorporate them and address them in future briefings or resources. But I think someone referenced the loss of research, and I just want to acknowledge what a big deal that is for us in public health, that the withdrawing investment in longitudinal studies, for example, that will have generational consequences. And for many, many families around the country who have a loved one who is hoping for breakthroughs in medical treatments and drug development for someone's health concern, this is so devastating. And I will just share that my nephew has Duchenne muscular dystrophy. It's a rare disease. And the families are waiting week to week for new options, treatment options to come out. And this is such a devastating blow that will have life-ending consequences for patients. And I share that because those stories are really important to tell too, that, all of our research and effort and policies and data, it's all because we're trying to address and improve folks' day-to-day lives at the community level and the family level and individual level. And so making sure that we're sharing those stories and amplifying the very, very real devastating consequences of these actions is really important.
Yeah, thanks, Joelle. I see we're coming up at the end of the time. I want to just throw one quick idea into the mix and invite folks to reach out if they have more questions about this, and then we can preview sort of what's to come. But it's the idea of preemptive compliance that I think folks have heard a lot about, and this thought of sort of getting ahead of what's being required, though potentially not legal or asked. And so I think just thinking through in terms of your own responding, are there risks actually of running afoul of the law if you go too far in the other direction to comply with some of these arguably or actually illegal directives, especially thinking about sort of in the DEI realm, dismantling programs or running afoul of other civil rights protections. And so that's a really meaty topic. I think that sneaking into the preview part of this, our next session, I think, is going to be specifically about the DEI executive orders. And I'm sure we will get into that a little bit more in that session. But if you have questions, we cannot provide legal advice because we are not your attorneys. But if you have questions about what the law says and need some help navigating what do these actually say and what do they mean, please reach out to us, because I think that part of the intent behind some of these actions is that preemptive compliance. They may know that there's not like a real chance of surviving litigation, but in the meantime, there's a lot of harm that can be done, as Joelle said, and particularly to certain communities. So I just wanted to put that on the table, and then, maybe we'll pivot to what's to come.
Yeah, so I feel like we've been talking like auctioneers this very brief webinar, and so we have a lot to share, and we look forward to some of you being able to join us. The series is going to be every 2 weeks on Wednesdays at 11 a.m. Pacific, 2 p.m. Eastern, and I will add 1 p.m. Central because that's where I live. If you've registered for this session, you're already registered for the whole series. As Sabrina said, next up is the DEI executive orders, and then I think we'll follow that with the LGBTQ specific executive order, and we're going to keep working through topics as long as we think that this is meeting a need in the community. We would love your thoughts on additional topics. I have seen things coming through in the chat of additional questions folks have that we will try to figure out how to answer. And then we also are, you can find out more about our resources and things coming out on the Act for Public Health website. And our colleague Leslie Zellers has been sharing resources like a mad fool in the chat here. So thank you, Leslie. But also there will be a survey that pops up after this webinar. And that's another place you could share the questions you have or topics you'd like us to dive a little deeper on going forward.
Yeah, thank you. And you may have said this, but I'm also trying to track the auctioneer volume of information, but we will send an email with the recording of this session that you can share with other folks as well. And we have a bunch of these resources, as have said, we'll send them out, but they're also posted on the Act for Public Health website. In our FAQs, we also link out to other resources. And if you know of great resources that you think we should be linking to or sending to folks, then please send them our way, because our hope is to be a bridge and an information provider as much as possible right now.
And I know I speak for Sabrina because I've heard Sarah DeGia say this before, but there's no wrong door for us. So if we can't help you or we're not the right resource, we will try to connect you with the right folks to get you the answers you're looking for. And then as we're just right at the end here, I just want to say, thank you for participating. Thank you for hanging in there and trying to continue the work as much as you can in a really difficult environment. We are going to get through this. It's, the only open question is how we do it. And I think the answer to that is we do it together. So thank you for joining us and for continuing your work in public health.
Yes, thank you. Thank you, Joelle, for partnering in this conversation. And we will be back with more information soon. Thank you.